Okay, so the consultant's been called, Dad.
Right. Will she come straight away?
She will come as soon as. Here she is here.
Hi. Right. I'm Amy. I'm one of the consultants.
Oh,
is this Susie?
It is. Yeah.
And your dad, is that right?
I'm Jack. Yeah.
Hi.
Yeah.
Can I borrow someone's stethoscope? Thank you. So I understand she's been unwell for about 12 hours now?
Yeah,
right?
since last night she's been like this, constantly coughing or non-stop.
Okay, so my registrar who came to see her before has told me a bit about her, and I understand she was also quite premature, is that right?
Yeah, she was 29 weeks when she was born.
Okay.
Yeah.
And did she need some respiratory support
She
when she
did.
was
She
first
had
born?
the mask on her face for a couple of weeks.
And since then has she been quite well?
She just had one or two little mild chest infections, but been able to treat it at home, you know.
Okay, so it's just really the last 12 hours she's been struggling?
Yeah, horrendous. She hasn't eaten anything at all.
Okay. Wet nappies?
The last couple of nappy checks were dry.
Okay. And what have you been told so far in terms of what's going on and what the plan is?
It's gone up, mate. You mentioned something about ICU, but sorry, it's...
That's all right, don't worry. I'll reassess that and then we can explain everything again.
Okay.
Is that all right?
Yeah.
Okay. Then have a listen to her chest. Let me see. Starts at 90. And there's got a good going wheeze. And some correct. Okay. So she looks very much like she's got bronchiolitis, which is really common in this age, normally caused by a virus.
Right.
And babies struggle with their breathing because their airways are so small and they get a bit inflamed with the virus that's there. Okay, so our job is to support her breathing. If the oxygen is not doing the trick, which it doesn't look like it's doing at the moment, would you be able to set up some Optiflow? We can get her a special machine that just delivers a bit extra pressure to keep those airways open so that she can rest. The machine does the work of that breathing for her, it supports her breathing.
So it's a bit like the mask she had.
Yeah, very much so. And if she needs extra oxygen, we can give that too at the same time.
Right.
Has she got cannula in yet, or is that on the way? No?
No.
So do you think you might be able to get a cannula in?
Yeah.
If we can do a gas as well, please can you order a chest x-ray? We'll write her up for some fluids as well so that she's getting what she needs. You can put her on 2/3. Have I forgotten anything?
Maybe do you think some saline nebulizer?
Yeah,
might
that's a good idea. Yeah, so that will just help loosen up all of her airways as well, and help when she gets ready for it to breathe as well. Anything else?
Are you sure it's bronchiolitis?
Well, I think because she's coming quite poorly, we are actually going to start her on some antibiotics. So if you could write her up for 50 mg per kg of ceftriaxone as well, please.
Yeah. Okay.
Not all babies need antibiotics in bronchiolitis, and most babies don't, but because she is working so hard, we will cover for that. And when we send bloods off to the lab, we'll get a culture. If any bugs grow, we'll know what to do with her antibiotics. But we'll put her on what we call some broad spectrum at the moment, and that covers for everything in case it's sepsis or something else going on. But she looks quite classic of bronchiolitis.
She's going to be okay, isn't she?
So we need to keep a close eye on her. So once we get the Optiflow on, we'll then do a gas to see what her oxygen levels are doing and her carbon dioxide levels are doing. It gives us a very quick picture of how well or unwell she is, and that will guide us as to whether she needs a bit more oxygen or whether what we're doing, we've reached the ceiling of that, and then we need to involve other people such as anaesthetics or such as intensive care. So we'll do one step at a time, and we'll closely monitor and keep an eye on that all the time. Yeah. Do you have any other questions?
No, I don't. No, thanks. Thanks for what you're doing.
Okay. Jess, do you think there's anything else I've forgotten? Or
no, I don't think so. It's all set up now. The everyone's all set up.
So we go and get it sorted, okay?
And doctors can explain to Mum as well when she comes, so don't worry about that.
Right. Okay, thanks.